and welcome to this edition of Health Options. Health Options is the program that not only tracks government's policies on health, but helps you with the information you need to make informed choices about your health. Thanks for joining us on the program. I am Rabi Abdullah. In the face of the ravaging coronavirus pandemic, Nigeria's goal is to vaccinate 40% of our population against COVID-19 this year. For starters, the country is expected to take delivery of 100,000 doses of the Pfizer vaccine. The vaccine, which is a donation from the COVAX facility, aims to slow down and interrupt the transmission of the COVID-19 in the country. It will also interest you to know that Nigeria is not folding her arms and waiting for provisions from other countries, as the federal government has released 10 billion naira for local vaccine production. The Minister of Health, Dr. Osagie Ehanire, is the guest on this episode of Health Options as we discuss second wave of COVID-19 and vaccine. You are watching Health Options, and we're taking a look at the second wave of COVID-19 and, of course, issues revolving around the COVID-19 vaccine. And I have with me the Honorable Minister of Health, Dr. Osagie Ehanire, to give us some insights into what is happening at the moment. Thank you so much for coming on Health Options, Honorable Minister.
Thank you for inviting me.
Yes, second wave of COVID-19, and trailing it is the issue of the breakthrough, talking about the COVID-19 vaccine. Before getting to the issue of vaccine, let's quickly take a look at the current happenings around the second wave of the pandemic. I know that there's been a spike. What exactly should Nigerians do for us to reverse the situation? What will be the quick fix in view of what is happening in other climes?
Yes, what we need to understand is that preventing the increase in infections of COVID-19 is a joint effort of government and the people. And the people, in fact, do have a bigger role to play than the government. The government gives the guidelines, understands the problem, and relays it. But compliance of the people, the cooperation of the citizens, is extremely important here. We know the factors driving COVID-19 infection are the not wearing a mask and gathering in large groups, and also not obeying the what we used to call the non-pharmaceutical interventions, which we now call the public health measures. These are extremely important, especially in view of the fact that new strains of COVID-19 that are virus that are coming out are believed to be far more easily transmissible. So the less you protect yourself, the more likely the infection will come across to you. Therefore, mutual self-protection by distancing and also by putting on a mask is a safe way to reduce the opportunity for the virus to move from one person to the other. The virus actually moves from one person to the other, and we need to work on that with the cooperation and participation of all citizens in that respect.
Gone were the days when there was so much emphasis on ventilators. That has obviously shifted to oxygen, and we seem to have deficits in our treatment centers. What's being done?
That's a global problem. There is almost no country now that is not having that challenge. All of them are having the challenge of oxygen, even of beds, of staff, of nurses. If you look at what is happening in the high burden countries, in the Americas and in Europe, they are suffering exactly that. They don't have enough personnel, they don't have enough oxygen and enough medication or enough beds. Sometimes they have to even start rejecting patients. So we are also getting to that phase now where we are discovering that we don't have enough oxygen. In fact, the importance of oxygen is just becoming more and more clear. And at first we thought we are okay if we use oxygen concentrators. But the oxygen concentrator doesn't give you the high flow of oxygen that you need from a higher concentration. So we're looking at the high flow oxygen, which will only come from oxygen plant. And the government has agreed to, in the first place, refurbish 5 oxygen plants in the Abuja metropolis. 5 at the National Hospital, the University of Abuja Teaching Hospital, the Federal Medical Center, Jabi, the Asokoro District Hospital, and the Karo District Hospital. They will have oxygen. So Abuja will be able to take care of all its COVID patients who are short of oxygen. For the rest of the country, the government is going to build 1 oxygen plant in every state that will produce oxygen for the use of the state. So we are trying to preempt that situation where we become too short of oxygen. In the meantime, we are doing a lot of self-supporting, one producing center supporting the other, and the Air Force has been supporting us because the Air Force has an oxygen plant in Yola. So they support us, everybody chipping in to help the other at the moment to bridge the gap. The Global Fund has also promised to support us with oxygen plants. So we are going to have a lot of oxygen plants. If we can work fast and hard enough, we shall be able to have all these plants ready before the COVID situation gets too serious.
It's heartwarming to know that scientists around the world were able to, make that breakthrough coming up with, even though people are saying it's unusual considering the space, of time that they were able to put it together. When you take a look at how long it really takes for one to come up with the development of vaccine, taking all the precautions into consideration, what do you call it, pre-qualification, clinical trials, and all of that. This is unusual, and that is something that has given rise to some conspiracy theories and hesitancy. We can't manufacture yet. We don't fall within countries that can manufacture. We know of the COVID vaccine that is in the offing. Give us an insight into the Nigerian situation and our uptake on now that COVID vaccine is available.
Yeah, correct. We do not manufacture vaccines. Most countries in the world are not manufacturing vaccines, so we do not have access to the technology, although we are trying to get to that level of being able to manufacture vaccines. Only few countries are manufacturing the vaccines, and those countries are first and foremost reserving what they manufacture for themselves. Pfizer, as we know, manufactures first in the United States and also in parts of Europe. They have commitments to these countries where they manufacture, and the same goes for Moderna, and the same goes for AstraZeneca. We work with the COVAX facility, which was set up by WHO and Gavi and other partners to support the so-called low and lower middle income countries with vaccine access by getting money either donated or borrowed from the World Bank and from Bill and Melinda Gates Foundation and other sources to be able to place order for vaccines that will be given to these countries they are working for. They are also joined by the few high-income countries, the self-paying countries who are also participating in this initiative to get access to vaccines. And once they get vaccines, they will distribute to their members, and the aim is to be able to provide immunization for 20% of every population. But we shall have to pay for the cost of logistics, for getting it into our country, for storing it, and for distributing. Most countries in the world now are working in groups. Africa, we are also working in a group through the African Union. The chairman of the African Union set up the African Vaccine Acquisition Task Team that is to take care of the needs of African countries, many of whom are small and might not have the resources So they are supported by the Afrexim Bank, which has put $2 billion on the table to procure vaccines and support African countries in a so-called whole of Africa approach so that no country is left behind. We are now helping ourselves in order to have access to the vaccines and be able to immunize 60 to 70% of our population. If we are getting 20% from COVAX, the remaining 40 to 50% will have to be from other sources. And that is why the AVAT facility is our next choice.
Okay, let's look at the first 100,000 doses that we're expecting. By the way, when are they due in the country?
Well, the first 100,000 is very small and almost not going to meet any of our very basic needs in our plans. But that is a number that the COVAX facility can give us as what they call the first wave. It was to come in at the end of January, then it has now gone to February, and we are now hearing that it might be March. But I think the manufacturers who have promised them these vaccines are having to meet other commitments to other countries, which have been made to other countries. So we expect that by February or March, the 100,000 doses from COVAX should come in. About the same time, we're expecting 10 million doses from AVAT, the facility.
Okay, 100,000 doses. That will translate to 50,000 people if it's so busy. 2 doses to be administered on a person.
That is why I say it is very small, and that is why we are also, as I say, putting emphasis on the 10 million doses which we have ordered. We want to increase that one in our order with the AVAT facility. That particular order is made up of the 2 dose per vaccination type and the single dose per vaccination of Johnson & Johnson.
That's on our own purse, right?
In order to avoid delays, the Afrexim Bank will pay, and then we now reimburse the Afrexim Bank either directly or in installment, depending on the capacity of the African country.
South Africa was able to put money to procure vaccines for its populace. Is it that we're not that buoyant to do such?
South Africa is working through the AVAT facility also, because the president of South Africa is the chair of the African Union and also the chair of the AVAT facility that is procuring for the whole of Africa, and they have secured 270 million doses to be delivered as from March or perhaps April. So it is from there that they will get their own facility also. But the 20% COVAX will also cover a part of South Africa and other African countries who are participating.
Okay, in view of the storage conditionalities given, for these vaccines, do you think we really have what it takes, or we're prepared enough, to preserve them when they get here for maximum potency?
Yes, that's correct. The likelihood is that we are going to get the Pfizer vaccine first from COVAX. And that's a vaccine that has to be stored at about minus 80 degree ultra cold chain storage. And we have those facilities in Lagos and some in Abuja where we can store a limited amount. But outside of main cities, it will be difficult. So our strategy is not to rely entirely on that type of vaccine, but on the type that we can store in ordinary refrigerators, even using the solar-powered refrigerators that were used in the polio campaign, which can be reactivated or which can also be repaired or replaced if they are in any way defective, to store the vaccines that can be stored at between 2 and 8 degrees normal refrigerator temperature, and use those ones in many other areas where we can't use the Pfizer vaccine.
How long the vaccine confers immunity on someone?
there are few people who have really taken this measurement of the antibodies that you develop. And that measurement has been done on those who actually had the infection. And since we started seeing the administration of this vaccine just in December, nobody has taken it long enough to know how long it gives you protection. But the projections of the moment, based on the experience of those who suffered the vaccine, the virus infection, is that it doesn't seem as if it gives you lifelong immunity, because there are people who have been reinfected with COVID after they had it once. And there are people who, in fact, have had it 3 times. So the projection is that it gives immunity of 6 months. Some have said 9 months. Some have said 3 months. So it varies. But we're hearing that there's one that gives you 2 years. That is the Russian vaccine that says they can give. Their own study is that they believe that their own vaccine can give up to 2 years protection. But all those are things that haven't been proven. They are still under contention, under study, and we shall know as time goes on.
You just mentioned Russia, boasting of the ability of theirs to confer 2 years immunity on people. Back home, what efforts are we making? I know that funds have been approved for local production of COVID-19 vaccine. What's the story around it?
Yeah, the story around it is that we have been lucky to have funds released for local production of vaccines. And we have one vaccine company, partly owned by the federal government and partly owned by another company, in a joint venture to produce vaccines. And they were figuring on producing the routine vaccines that we know, against tetanus, diphtheria, DPT, those vaccines that are normally used in routine immunization. But we are drawing their attention now to the fact that this COVID vaccine is another opportunity for them to venture into vaccine production, COVID vaccine production, where they have to look for a partner. But for them they are not doing research, they are producing, and their job is to produce. So they have to get the research products or partner with someone who was already producing and gives them a license to produce. Once you have developed a vaccine, you can license any other producer to produce it if you give him the formula. So to say, you share the formula, you have a financial arrangement that allows you to produce more the other party produces using your formula. And in the same way, we are hoping that we can get a partner who allows us to under license to produce. But as far as the research and development is concerned, yes, we have research and development going on too in our research centers, and which have produced promising vaccines. But after producing promising vaccines, you have to test them, and the testing is extremely expensive and it takes time. You have to go through the various phases, and after it has been proven to be safe and effective, then you can now sell the formula to a producer to produce.
I know South Africa was part of the clinical trials. Nigeria wasn't. What does this portend for? Is it okay that we're going to receive such vaccines that were not part of the trial? Do we even have clinical trial facilities? Can we undertake clinical trial for such vaccines back home?
Yes, you can. You can do clinical trials anywhere. It is the organization, the research organization that is developing the vaccine, that will now do the clinical trials, particularly phase 3, where they now test it on volunteers.
For instance, if we take delivery of the ones we're expecting now, what sort of quality assurance are they going to go through back home?
The first quality assurance is quality assurance by NAFDAC. Okay. NAFDAC will have to ascertain that it is safe. It is not dangerous, it is not harmful, it is not injurious. So NAFDAC will give that clear bill of trust. And then in some countries you also get what you call a regional qualification. In Africa, where apart from NAFDAC, we have the African Medicine Agency. In Europe, you have the national agency, and you also have the European Medicine Agency, which is a larger organization bringing all the experience of all the countries to also test it. So it tests it at 2 levels. And then the 3rd level is the WHO. World Health Organization can also give you the clearance, what they call the WHO pre-qualification, that says, yes, we have tested it, it's safe, and it works. It's safe, and it works. It's actually effective. So, but the WHO is not really doing that yet now because all these vaccines are so new. What the WHO can do is that, yes, we have seen this vaccine, we have seen that it's been given, it's safe, so they give you the listing, emergency use listing. Other countries do what they call the emergency use authorization, authorize you to use it, and the company giving it to you will ask for indemnity and say, because this vaccine is brand new, it was developed so quickly, we have done all the tests that says it works, but we do not have the guarantee. So therefore, give us an indemnity. Indemnity means that you take it at your own risk. If anything happens, don't hold me responsible, because we don't know everything we need to know about this vaccine. We believe it works very well, but we cannot be held very responsible. That's to say, the user, in which case the country has to indemnify the company and say, well, we are buying it and using it for citizens. If anything happens, we as a country will be responsible. We will not hold you responsible.
Is that the kind of agreement Nigeria had entered into?
That is the kind of agreement all countries have to agree to, all. Otherwise, the company will say, well, sorry, we can't give it to you if you do not agree to hold us, if you give us indemnification. All countries have to do that, because the vaccines are so new that you cannot give 100% guarantee as you can give for others that are already very well known. Yes. It's just a measure of safety and protection for the producer.
Okay. Do you take supplements?
Yes, I do take supplements. Everybody takes supplements. I've been taking supplements for a long time. 1 tablet of the general vitamin that I take every day is advisable. I also advise people to eat healthy. Make sure you eat fruits every day, 1 fruit or the other. Make sure you eat vegetables. So if you're taking vegetables, taking fruits, and taking a vitamin tablet, you're okay. It doesn't have to be a specific type. It can be a general type. Just to cover up, just in case there is any kind of deficit, your body will extract it. If your body didn't have enough of that, you will not take it.
Yeah, well, so some experts have said that we actually don't get the nutrients, the adequate nutrients we require from the foods we eat alone.
Yes, if we have a balanced diet, the likelihood is that we will get most of the nutrients we need from the food. But sometimes, just to be sure, and the vitamins are not expensive, you pop in one in case there's anyone that's short, the body can absorb it. Otherwise, it will not. So it doesn't harm at all. It doesn't do any harm. You don't suffer from too much vitamins, but at the same time, you also will able to take care of any shortage a shortage of any ingredient you didn't know about. So, but it's not with attention to COVID-19. It's something that I've been doing since many years.
Now you know. This is where we end this week's episode of Health Options. You can go to our YouTube channel to watch the upload of these and past episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Take responsibility for yourself and the safety of others. Thanks for watching. Hope to see you again.